Receive my greetings. I hope that you're fine and that God has kept you safe. I'm also fine and I thank God. Today I want to discuss an infection called Candidiasis, a very common infection in women. And in particular, I will be discussing about recurrent yeast infections. Okay, Candidiasis is a yeast infection, and I will be discussing about recurrent yeast infections that occur every now and then. It has occurred this time, you treat it successfully. The other time it has reoccurred, you treat, it recurs again. So recurrent. So this recurrent yeast infection, as I said, it's called Candidiasis, but the medical term, it's called recurrent vulvovaginal candidiasis, RVVC, recurrent vulvovaginal candidiasis. So at what point do these yeast infections become recurrent? So if you get more than 4 yeast infections per year, now that is recurrent. So you should get at least 4. But if you get more than 4 yeast infections per year, that has become recurrent. So what really happens so that we can have yeast infection, the candidiasis, the recurrent vulvovaginal candidiasis? I want to let you know that normally the female reproductive tract, precisely the vaginal, the birth canal, the vagina, has normal flora, normal fungi called albicans, but it is in small amounts. So yeast infections come when these albicans, the normal flora in the vagina, become overgrown. They overgrow. They become too many. They multiply. So that is when we have yeast infections. So we will see what can cause the multiplication and the overgrowth of the normal flora, the albicans, in the vaginal tract. Therefore, I want to let you know that the specific species that cause yeast infection is called Candida albicans. Although we may have other species that are not Candida that can also cause the yeast infection, but mostly and commonly we have Candida albicans. I want to discuss on the symptoms. How will you know as a lady that you have yeast infections? Point number 1, it's redness and swelling on the vulva. Redness and swelling on the vulva. You can check the vulva, it's called labia majora. We have the labia majora and the labia minora. The muscle, the skin that covers the outside lining of your vagina. So redness, it has become red and swollen. That is an indication of yeast infection. Another thing is burning sensation when you are urinating. You feel like something is burning you when you are trying to pee, when you are trying to urinate. That is an indication of yeast infection. Another thing is painful sexual intercourse, what we call dyspareunia. When you are having sexual intercourse, you feel pain, a lot of pain, severe pain. That is an indication of yeast infection. Another indication of yeast infection is thick, white vaginal discharge that looks like yogurt. Very thick, white in color, and very thick and white vaginal discharge. Most of the times it resembles cottage cheese, cheese, that product from the milk. But understand it like it looks like yogurt, very thick vaginal discharge. That is an indication of yeast infection. Another factor, another symptom could be itching and irritation around the vagina. You feel like ujikuna, very itchy vagina, itching and irritation around your vagina. That is also another indication of yeast infection. So I want us to look at the causes. What causes yeast infections? Number one, we have the overgrowth of albicans. We have said we have normal flora, we have normal albicans in your vagina. So when they overgrow, when they multiply, they give rise to yeast infection. The other factor is antibiotic use, especially when you misuse antibiotics. This can predispose you to yeast infection because antibiotics can interfere with the normal balance in your normal flora, in your normal albicans in your vagina. Another thing is wearing tight clothing and tight underwear that is not made of cotton. Wearing tight clothing, that is also another cause. Another thing is a diet that has high sugar content. High sugar diet. It's also another cause. The other factor is sexual transmission. Okay, generally, yeast infections are not classified as sexually transmitted infections. Okay, I want to clarify this. Yeast infections are not classified as sexually transmitted infections, but sexual activity can contribute in the transmission of yeast infections. Do you know why? Number one, men can have yeast infection, what we call Candidiasis. No, balanitis, sorry. Candidiasis. It is yeast infection in male. So when you have a partner with Candidiasis, which is yeast infection in men, and you have sexual unprotected sexual intercourse with him, then he is going to transmit the infection to you. Another factor on how sexual intercourse, sexual activity can transmit yeast infection is the friction that is there during the sexual intercourse. You know, there is friction, can alter the normal balance of the albicans, the normal flora in your vagina. And that balance, when it is altered, then the yeast infection can come in. So that's how sexual activity can come in as a factor, as a causative agent of yeast infections. I wanted to clarify that. But it is not classified as sexually transmitted infection. Another factor that I wanted to discuss, but this one in length, is hormonal imbalance. I want to discuss hormonal imbalance, and I want you to understand it in this way. We have two main hormones, estrogen and progesterone. Estrogen, normally it is the hormone that is associated with secondary sexual characteristics. So it comes a time where we have hormonal changes and the levels of estrogen can become too high and the levels of progesterone are too low. And this leads to something we call estrogen dominance, whereby the levels of estrogen are too high. Although we have two scenarios where we can get estrogen dominance. One, we have abnormally high levels of estrogen. That is scenario number one. And number two, we can have the normal levels of estrogen, but the levels of progesterone are too low. So estrogen is normal, within the normal ranges, but the progesterone is too low. We will have estrogen dominance. So those are the two scenarios where we can have hormonal changes, hormonal imbalance. I want to discuss it in length.